Cleaning and disinfection of equipment are key to infection control. This video will show you how to effectively clean an Omnicell automated dispensing cabinet. You can use similar techniques on other Omnicell equipment. For complete instructions, including types of cleaners recommended, as well as COVID-19 and EPA resources, see the links provided at the end of this video. Omnicell recommends that you clean cabinets daily to every 2 weeks, or as directed by your institution. Before you begin, some common guidelines include: 1. Wear personal protective equipment such as disposable protective gloves, protective gowns, face masks, or eye coverings as appropriate. 2. Clean surfaces with a damp, lint-free cotton cloth or equivalent. Never use spray products directly on the cabinets, as this may harm the equipment. 3. For Omnicell tested solutions for cleaning or disinfecting, refer to the Omnicell Equipment Cleaning Guidelines document linked at the end of this video. Begin at the top of the cabinet and work your way down. Clean all exterior metallic surfaces. Wipe button bars and glass surfaces. Pay particular attention to areas commonly touched by users. Fingerprint reader, touch screen, keyboard, label printer, barcode scanner. Wipe down door handles inside and out. For medication storage drawers, wipe the front, sides, lids, and handles. Do the same with bins, including any external return bin. Properly dispose of all waste. Allow the cabinet to dry before returning to service. Frequent cleaning and disinfection of pharmacy products is essential for daily infection control. It also helps reduce the potential transmission of pathogens while ensuring cost-effective personal and environmental safety and product performance. For more information on cleaning and disinfecting Omnicell equipment, log on to myomnicell.com or call 1-800-910-2220.